Hello and welcome to PSGMA. I am your host, Reverend Jesse Black. I am back again with Miss Marie Humans, and she's going to give us an update on what we talked about the last time we discussed with her healthcare issues. So, Miss Marie, I know we were talking before we went on camera. You mentioned something very, very important, and you were mentioning the difference between the money that's on those cards, whether it's Humana, United Healthcare, no matter what company, versus, let's say, dental insurance or the dental payment. Can you explain that a little bit more?
Yeah, so in Medicare Advantage's plan, they are automatically allotted benefits. Those benefits they may be more dental, or you may get more on your flex benefit. This is the allowance that you get to pay for copays, buy healthy food, or you can pay utilities with it. So it puts people in a situation where they have to decide what they really need.
Okay.
So some carriers offer up to like $4,000 for dental, and then some may offer $2,000 dental as a max. So what happens is they have to make that decision. I'm finding that a lot of people are in a situation where they want to lean more of the food benefit and they're not really worried about the dental. So it's kind of like the carriers are saying, okay, the reason why we're not giving you the full flex benefit amount on the card is because we gave you this $4,000 dental. You don't get one, you get one or the other. And it just kind of puts people in a situation where they have to make that decision. And then you think about it, they're getting this amount. So let's just say you're with a carrier and you get $200 a month. Some of the chronic plans, you may get $90 a month or $45 a month. Now, it was 90, it dropped down to 45 in 2026 for some carriers. So they get that and they have that for 12 months. Some carriers let that money roll over. So if they don't spend it, if they're saving, for the next month, then they'll do that. But most of the carriers don't allow it to run over. So if they don't spend it by the end of the month, they lose that amount for that month.
Okay. So you were, you said you were using math with the people. And I want to go back just a moment to our last time we were here. All this came about because of what is being done in the White House. The outright obliteration of healthcare here in America. The taking away of Medicare, Medicaid benefits, along with, as Marie just said, these cards. So when you look at, you said one plan may offer 4,000, one may offer 2,000 as far as dental. And you were telling me before we went live that people are deciding to keep $200 to pay a bill versus $4,000 for, let's say, dentures.
Yeah, for dentures. Yeah. They are like, because what happens is if they give you the full dental amount, say you got the 4,000, but in one plan and you elected to take a lesser amount of the flex card. So let's just say you have an option to have $170 a month, or you can have $260 a month, right? Of course, most people say, well, hey, I'll take $260. I don't want $170 when I can get the extra money. So when you choose the higher flex amount, then you lose the most of the dental benefit. So that drops that 4,000 to 1,500 or 1,000. That's a big difference.
Big difference.
That's not enough. If you look at the cost of a full set of dentures, that's not it doesn't even give you close. So that puts the financial responsibility back on that person.
Okay.
Yeah, and they've already exhausted that fund now because they're using the flex card.
So let's look at a scenario. So let's say I have the 4,000, and on most people don't realize this, but you should have at least one or two cleanings a year.
Yeah.
Why is this important? A lot of our healthcare deals with our teeth, whether we know it or not.
Yeah.
And you may have signs that something else is going on with your body, but if you do not get your teeth cleaned, if you're not really paying attention to halitosis, bad breath, that comes from different health problems. It's not just bad breath.
Yeah.
Vision.
That's one of the things too that you get less of when you take the higher amount. So if you choose to get the full 260, and I'm making these numbers up just for this conversation, 260, and instead of the $160, $170 a month, then now you may only get one eye checkup a year. And you only get an allowance for $100 for glasses or $150 for glasses, where you could have got the full benefit amount. Let's just say it could have been $500, but you elected to take the card. So now that drops the eye and your dental benefit. So the patient responsibility is to cover that difference.
So let's look at what she just said. For the Black community, we understand that glaucoma is very rampant. If you are electing not to use those benefits, anything can happen.
Mm-hmm.
So I want to ask you about what do we see coming in the near future? What will be the end of, let's say, 2026 or 2027?
So we don't know. I would say the best advice I could give everybody is to actually learn their plans. Review them, sit down, make sure if you have any specialists, if you have any primary care physicians that can just stay on top of your health. Make sure you review these plans, make sure that you are in network, because we are often finding that some of the hospitals and doctor practices are in and out of network. Stay on top of that, because that's where the surprise billing comes from.
Mm-hmm.
There are things in place for you, but you have to do your due diligence too to understand how your plans work outside of the food cards, the flex benefit cards, and just because the dental is important, your vision, the health portion is it's important too.
Mm-hmm.
So you don't want to put yourself in a situation where you're taking this benefit and you're not getting that healthcare portion, because that's the whole purpose of the plan.
Okay.
Yeah. So just stay on top of that and make sure that based on your health condition, that plan actually fits for you.
Right.
There's several different carriers. There's several different plans, but you need to make sure you're on the right one that fits your situation.
Okay. So before we end this episode, I want to thank you once again for coming on. But this information is very, very, very vital. Most of the elderly people, as you mentioned earlier, they're not reading their mail. They're not really following with this. Is it any way they can get in touch with you if we were able to set up a workshop, what would we need to do to set that workshop up with you?
I just need a date, location, and as many people as you can get there. We want to partner more and do like health fairs. We want to go over, because a lot of people have Medicare, but they're not familiar with what comes with that. They get the red, white, and blue card. They just get on a plan out of frustration, but they don't really understand how it works. So I would like to do benefit reviews and actually tell them what they have, what what they should have if they don't have the right thing. After having a conversation, I'm willing to do one-on-ones, so they can schedule that time with me. And I do in-home visits. So they don't have to do this over the phone. I actually do in-home visits.
Okay. Before we end this, do you have any last words?
I think we just addressed it. Yeah. What can I do to help the community more? And that's what. So if there's anyone that has a space and they're willing to give the time and the contacts, and they have some seniors that actually want to sit with Unified Partners, then we're more than willing to team
How
up.
can they reach you?
My email is marie@upgteam.com. That's MARIE. And then upgteam.com.
Okay. Mm-hmm. And your phone number?
803-319-4117.
Amen. And thank you guys for tuning in, and may God bless and keep you is our prayer.